Hiya, Leslie. How are you
Lovely.
doing?
Hello, welcome. This is Emma Riley, and she's going to talk about mouth cancer in older people. And I'm really interested in this because with all this lack of dentist appointment, who's looking in the mouths of older people? So off you go, Emma. Thank
Thank you.
you.
Thank you for having me today. I've taken the opportunity of asking to be put on this webinar. I am the ambassador for the Mouth Cancer Foundation. I'm also chair of the Society of British Dental Nurses, and it's Mouth Cancer Awareness Month. And I think the mouth, I'm going to say this because it's my job and I love my job. The mouth is the gateway to the body. The mouth for me is the way in there. We can laugh, we can cry, we can eat, we can drink. Everything goes through the oral cavity. And as Leslie was just saying, we're having a few challenges with the oral cavity at the moment, with lack of dentists, lack of support within care homes. I think particularly in primary care home staff are heroes. I think the nurses on the wards are heroes too, but mouth care can be very, very challenging. I have two parents with dementia. One is an ex-dental nurse, believe it or not, and I'm struggling doing her mouth care at the moment, and she's an ex-dental nurse. Mind you, she probably knows what I'm doing. That's probably the right reason she doesn't want me to do it. So thank you for having me here today. I am going to mention mouth cancer, but I have put a couple of slides in looking at mouth care as a whole. I do apologise, I'm on two screens, so if I keep looking at you, it's because I'm on a couple of screens here. So it's not working. There we go. So I've titled this Oral Care for All and Everybody because that's what it means, from the age of when you're born right the way till the end of life. A lot of my work is with end of life and palliative care. Everybody should pass with a healthy, clean mouth within, it should be to the best of our abilities. But we are seeing some really poor mouths towards the end of life and in general, actually. Oral care is an important part of daily care. It's part of holistic care. Everyone, and I mean everyone, has a right to an infection-free mouth, clean mouth. Oral care is a lifelong priority, and routine daily oral care is essential for oral health and well-being. It impacts on everything. It is so important. I thought this was interesting. It's estimated that by 2050, almost 1 in 5 of us will be over 65, equating to 1.6 billion people, and that's from the Oral Health Foundation. We are keeping our teeth longer. So when I first started out 35 years ago looking in people's mouths, we did see you hit a certain age and you had full dentures. Some of you might, I mean, my parents, my dad's got a full upper denture, the acrylic ones. My granddad had them. We are now keeping our teeth longer, although we're struggling with dental support to our most vulnerable people. They are keeping our teeth longer, which actually can cause a few more problems and a few more issues. It can be a little bit more challenging, but we are keeping them longer, which is good. Why is it important? Now you'll know why it's important, good oral care, but it's really good to remind ourselves. It's good to maintain good oral health and general well-being. So it was mentioned before about aspiration pneumonia. We know that there's a link between aspiration pneumonia and oral health. They go hand in hand. If you've looked on the press recently, we've linked it to diabetes, heart disease, preterm births. There's a very tenuous link to Alzheimer's, but these links are there. But for aspiration pneumonia, we know it's a biggie. So anybody who's got a swallowing issue really needs to have their mouth cleaned more than anyone. It's so important. It reduces the risk of oral conditions, which we're going to talk about. Helps reduce the risk of malnutrition and dehydration. It's really interesting what Mark was saying, because I deal with people with dry mouths who are dehydrated, and obviously the link to chest infections. The big one for me, the most important one for me, is right in the middle there, is quality of life. Honestly, it's so massive what the mouth does and impacts on quality of life. Right up there, trust me, with a lot of patients and carers and staff too. Let's look at mouth cancers. So I'm sure you've heard of mouth cancers. I'm hoping you have. We are getting the message out there about mouth cancer awareness, and it's Mouth Cancer Awareness Month. I haven't mentioned that, but I'm sure you didn't realise the figures And this has been impacted with COVID. Let's make no mistake about that. But the latest figures, which have just recently in the last couple of weeks, show that there's over 10,000 people in England were diagnosed with mouth cancer in a year. Unfortunately, we lost 3,634 people. We lost to mouth cancer, and more people in the UK die each year of mouth cancer than cervical and testicular cancer combined. It's a massive, massive problem, and somebody dies every 3 hours in the UK from mouth cancer. More deaths in the UK than road traffic accidents, and cases have increased by 38% in the last decade, and 133% compared with 20 years ago. So we really need to get on top of this. Why I wanted to do this and why I've been putting my focus on the elderly is this figure: 64% of mouth cancers are occurring now in the over 60s. I myself have seen these cases within care homes that I visit and I train in. And as you can appreciate, when we are seeing them in the elderly, there are many, many challenging aspects to that. So where do we get it? Where can we find a mouth cancer? By the way, hopefully you'll all be looking in your mouths when you've watched this webinar and this session later, or looking in your partner's mouth. Tongue, lips, inside the cheek, in the gums, roof and floor of mouth, tonsils and salivary glands. So that is where we can find a mouth cancer hiding. Why? Why are we getting that? Why do we see mouth cancers? Well, we do know that people who smoke and drink are 30 times more likely to develop the disease. And we must remember smokeless tobaccos as well that can impact on this. Tobacco has been linked to 2/3 of cases, and a morning cigarette can double the chances. So again, I know I'm here to talk about the elderly, but this goes for anybody who's watching this webinar at the moment. The HPV link has been a massive thing. You might have seen this in the press recently. So we've linked this, and they reckon in the next 10 years it will probably be the main risk factor. And more than half the cases in the UK are linked to a poor diet. We also know that sun exposure can cause lip cancers too. So these are why it is happening and why it can occur. Signs and symptoms. Now, there are other signs and symptoms, but I've looked at, just for now, just look at the elderly link to it. And it's very, very difficult to know with somebody with dementia if they've got a mouth cancer, because if you and I go to the dentist, we will lie back, we'll open our mouths, they'll do the lymph node check, they'll have a look in your mouth. If you can find a dentist and you've got a dentist, they will screen you for a mouth cancer every time you go for a checkup. Ask you to stick your tongue out, they'll look under your tongue, roof of mouth, and they'll have a good screening. They'll check your face and they will do a lymph check on you. Trying to do that, and some of my residents in the care homes can be, I know you're probably all smiling now, it can be a little bit, shall I say, challenging, and it can be an interesting couple of minutes trying to do that, but I've got some tips to show you how to do that shortly. But signs and symptoms with our elderly: numbness or tingling in the lips and the tongue. You might find them sort of feeling around the mouth, and that's a good sign. If they're smacking it, it might be tingling. Big one for us is dentures that suddenly stop fitting properly. Now, I know you'll see some residents where the dentures can get loose. That's because they might have lost some weight. But if all of a sudden they stop fitting and they're wobbling, that can be a sign that there's something going on in there. Normally we'd look for any ulcers that are not healing over a matter of 3 weeks. I'd expect you to be raising that up to somebody. Red patches, infections, a smell, an odour, all these things are things that we should be looking at. And also we need to pay attention to the skin in the face and the neck. I would hopefully, if a resident or you are caring for a loved one, you noticed a mole that had changed anywhere on the body, you would look at that. I know some of my friends have taken pictures of little areas on their relative's body just to check if it's the same size, same colour. I would expect that to be done with the head and neck. And if you can have a look in the mouth, I'd expect the same with the mouth as well. Sometimes we've seen with one of my residents, one of the teeth just fell out. Again, we do see teeth become loose, but if one tooth has suddenly just come out all by itself, and for what you would perceive no reason, we'd want to know why. While I've got you, I wanted to show you, this is a recent picture of what we found in a mouth of a resident in Rochdale. and I hope you agree it's quite harrowing. This lady had dementia but was still shopping with her daughter a couple of days before admissions. 2 days prior to admission for a fall, this patient had a full dental checkup with her GDP, with a general dental practitioner. So she was dentally fit before she went into hospital. The patient was on a hospital ward for 12 days in total, and the patient passed away within roughly 10 days of a hospital discharge. This is what we're up against with oral care. I'm sorry, it's not a very nice picture to be looking at, but this is the reality of what's going on. So I'm dealing with mouth cancers, but we're also dealing with mouths like this. And I'm sure anybody watching this might have had some instances of seeing mouths like this. This for me is neglect. If this was happening anywhere else in the body, this would not be allowed to happen. If this was the eye or the eyes, we would be trying to clean this patient's eyes. But if we're looking at this, how are we going to detect any mouth cancers that are occurring in the mouth? I'm sorry if it's not a very nice picture, but this is the reality of what we're seeing. This is what we've put is without oral care education and promotion of oral cancers, mouth cancers can be missed. And just because somebody's over the age of 60 does not mean we should not be looking for mouth cancers in somebody's mouth. Please don't. I'll be on here for another half hour if I carry on that tack. This is a Rochdale care resident. It's a 92-year-old female presented with a rapid growing mouth cancer. And these images you can see is on her palate, were taken 3 days apart, so it was quite a fast growing tumour. But with care, education to the care home staff, we were able to keep, this lady did pass, but with a little bit of TLC to the staff, we were able to keep this lady in her care home, and she passed away peacefully in her care home. But I just wanted to show you what can hide underneath dentures. And it was because the staff had had some oral health education and some training that they looked under the denture to see why it wasn't fitting quite properly, quite snugly like it normally would. But you can see how quickly it can grow. So I would expect that documenting and escalating up to somebody if they saw something that wasn't quite right within the mouth. Now, with this in mind, I wanted to do a video of what to look for and how to screen mouth cancers in residential homes. And this was this was a video that we did in a care home in Rochdale. Please look out for Peter, who stars in this video. He's one of the residents, and I think Steven Spielberg is going to be contacting him shortly to do some films because his acting was absolutely fantastic. Just let me see if it'll play.
Oral hygiene is important, whatever your age. But as we know that 78% of mouth cancers are now occurring in the over 55s, it is really important that care home residents are looking after their mouths and care staff are looking out for the signs and symptoms of mouth cancers. Regular assessments of the resident's oral cavity is really important. The ideal time to do this is when you are brushing or caring for your resident's teeth or dentures. If your resident is comfortable with you performing their oral care, this is the time to have a look in the mouth and see if there's been any changes by asking them to stick their tongue out, looking under the tongue, if they're able to, into both cheeks. When looking in the mouth, it's a good idea to have a pen torch. You're looking out for an ulcer that maybe hasn't healed over 3 weeks, tooth that maybe is unexpectedly loose, maybe an odour as well, or the denture isn't fitting correctly. Once you've done that, have a look at the face, have a look at the skin. Are there any bumps, any lumps that have appeared, or any moles that have changed shape or colour? This is the time to make a record of this. Now we know that providing oral hygiene care and performing these oral checks might not be straightforward. Some residents have some complex needs. We do know that nearly 58% of people in residential homes have got dementia. In these cases, we encourage staff, relatives and loved ones to use the look, listen and observe method. You know your resident. Look out for any subtle changes. Is there an odour coming from the mouth? Is the resident drooling all of a sudden? Are they losing weight? Listen to their voice. Is it hoarse all of a sudden? Or are they complaining they've got something stuck in their throat? Always look. Are there any lumps or bumps evident around the jaw, around the mouth? Any moles changing at all? These are all signs of a potential problem inside the mouth. In situations where the resident can be a little bit reluctant to have oral care provided or an oral assessment, we can either try a different time of the day maybe, or look at some of the distraction techniques which are really helpful. Meal times are a great opportunity to look, listen and observe your resident. If they're struggling to eat or drink, this needs documenting and raising with the senior person in charge.
So that video is available on the Mouth Cancer Foundation website. There are leaflets for that as well. Please have a look at it. So we've called it the look, listen and observe method. So looking to see if there's any lumps or bumps, listening, has the voice changed, and observing, is there any drooling. It's more about the person who's caring for this elderly person to know if there's been any changes, because they know them better than anybody. Granting that we can't do a full mouth assessment, it's just looking to see if there's been any changes. The leaflets, like I say, are available through the Mouth Cancer Foundation. Please check out their website, not just for the group I've spoke about today, but also any elderly people and yourself, anybody you come into contact. Now you've seen me today, please, please, please think about mouth cancer awareness. Just let me stop the share. Okay. Have I stopped it? Thank you. We've also done some, you can get in touch with Leslie. We've also done these pocket guides through Rochdale Council and the Mouth Cancer Foundation. There are pocket guide on conditions that might manifest themselves in the mouth. They're an education tool. If anybody would like the PDF of these, they are free. Please use them. And I've also done a QR code here, which is free. I can send the PDFs over to Leslie again. It's a video of me actually talking to the camera on how to look after a loved one's mouth, how to keep it hydrated, how to keep it lubricated. It's very simple. I had to make it simple, because if you don't and you start going into brushing teeth and what angle to go in with your toothbrush, it's just very, very simple of how to keep the mouth as healthy as we can right the way through. Like, I believe that we've got people live till they die, and I think the mouth goes on that journey. And I want people to be able to kiss their loved ones at any stage of their illnesses. So that's me. I hope I've not gone on too long, Leslie. It's just to try and promote for me mouth cancer, which is so important.
It's wonderful what you've done today, and I think I will put all those links on the website somehow so that people come on, because you know, unfortunately, those photographs of the mouth neglect is something that we've all seen, and it's really very poor practice, and we need to highlight that and raise awareness. We can't be letting that go. So I'll speak to you another time, and we'll get everything on the MTF website so that people can click through.
But thank you for giving me the opportunity to be doing this today. I really appreciate it. Take care, everyone.
Thank you. Bye-bye.
Bye-bye. Bye.